Good afternoon. Thank you for joining us for a COVID-19 virtual hall town meeting. Kevin and I are practicing social distancing by connecting via Zoom. And today we're going to talk about Johns Hopkins Medicine's evolving response to COVID-19. Today we're going to talk about how COVID-19 has changed the way we pursue our mission, what we've learned from managing this pandemic, and how these lessons will affect our strategic planning going forward. We'll also talk a little bit about startup plans for reopening the organization back up in ways that protect the health and safety of both our patients, our learners, and our staff. Kevin, when I think about the complexities that everyone is managing right now, it really is a challenging time.
You know, Paul, it really is. And you and I have talked about the fact that the team has been through a lot over the past several months. Not only have we been managing the COVID-19 response together personally, our team members have dealt with their own illnesses, with family members getting sick, with the disruptions, the fundamental ways in which we live together and interact with each other on a daily basis. Those things have been difficult on their own, but we've also seen the impact of social disparities throughout this pandemic. And I want to acknowledge the fact that it has particularly impacted members of our African American community and our Latinx community in a disproportionate way. So then you layer on the issue of racism experienced by Asian Americans and people of Asian descent, and the racism and senseless violence experienced by our African American community. And I think both you and I are worried about all of our workforce, and especially our African American colleagues who are experiencing layers of emotions from not only the pandemic, but what we've seen happen in recent events like George Floyd. And so we want to make sure that we reach out and take care of each other, and especially listen and understand the issues and the needs and the response that our African American colleagues are having in the midst of this. And you consider all those stressors, and then you add also on top of it the economic fallout from the pandemic, which impacts the bottom line of all of us across this country. And I just want to acknowledge the complexities of life that every member of our team are managing right now. And for our team members watching this, while you're taking care of everyone else, Paul and I both want to encourage you to take some time to do self-care, because it's imperative that you stay healthy, and especially if you need additional resources to help you cope during this difficult time.
That's right, Kev. We'll put up the website address for the Office of Wellbeing on the screen, and that's a resource for anyone at Johns Hopkins Medicine who wants to just talk to someone, who wants access to resources that will make their life a little easier. You know, as we consider wrapping back up, we've been talking a lot about resilience and making people sure that they take time this summer to disconnect a little bit, to rejuvenate. It's important to remember that this is a marathon. It is not a sprint.
You know, Paul, it really is a marathon, and it's a marathon that I think has multiple ramifications. And we spoke to all the stressors. One additional stressor is just looking at the impact COVID has had on the financial performance of healthcare organizations and all parts of our economy, especially here at Johns Hopkins Medicine. In this fiscal year, we've had to make some difficult decisions because of the financial impact COVID-19 has had. None of these decisions are ever easy when you have to make them. But you and I agreed that one of our top priorities was try to preserve as many jobs as we could. And that's why we took some of the actions we did in this fiscal year to help stabilize our financial performance in this year. As I look to FY21, which begins in July 1, I am confident that we will rebound and be in a very different financial position. But I'll add one caveat to that, and that is something that none of us can predict, and that's the caveat of the impact of a second surge on healthcare systems, not just Johns Hopkins, but across this country. If you look at how Johns Hopkins has fared compared to some of our peers across the country, we've done quite well in managing our financial performance, but it has had an impact on our organization. And so I thank everyone in advance for their understanding of the need to make difficult decisions. But our number one priority was to try to preserve as many jobs as possible.
That's right, Kev. I just want to reemphasize, because I know with all of the financial issues in the world around us, people are worried. And I think you said it really well. We made some moves that we had to make because we wanted to ensure that we'd be stable. We presented our financials in fiscal 20 and 21 to our board, and I think the board was supportive of the fact that we do have the resources we'll need. We've preserved jobs in terms of what we've had to do in fiscal 20, and we think we're in good stead unless, again, there is a huge second surge that might disrupt it. But given what we model out, we think we're going to be in fine shape in fiscal 21 and try to preserve as many jobs as we can. And others in our industry, when we look around and read, we have done well considering how much of an effect COVID-19 has had on us. One of the things that I've been most proud of is many people around here have really thought and planned ahead. It was one of the reasons we got ahead and were able to have the equipment we needed. We're able to move patients around the way we needed to. But I think as we move forward, we are thinking about the other issues we're going to have moving forward and perhaps other issues. Kev, talk a little bit about the field hospital, and you are really intimately involved in both that and the public-private partnership. So can you talk about those two things?
Yeah, we partnered with the state, and when I say we, Johns Hopkins Medicine and Dr. Mohan Sintha, who is my counterpart at University of Maryland, we came together realizing that if we tried to approach the pandemic in Baltimore City by ourselves as single systems, we would never be successful in serving our community. So the field hospital is a great example where University of Maryland and Johns Hopkins Medicine came together to provide the provider staff and all of the staff in the facility to serve our community. While that is a resource for the state today, it started as 250 beds, can be staffed up to 500 beds if needed. It has currently not been required to the extent that we thought, but we are keeping it open in need and proposed need for a second surge in terms of a part of our surge capacity. The public-private partnership was really an opportunity for Brian Pennick, who is the CEO of Care First, Dr. Mohan Sintha, who is the CEO of University of Maryland, and I got together and really looked at how we could partner with the city and state to mobilize resources to better serve the citizens of Baltimore City. And we looked at a variety of things. We stood up a call center that allowed people to call in and do everything from manage the worried well population to, if people were presenting with symptoms, getting them into a primary care provider for testing capacity. So that has been a resource that we actually brought into part of our process. The other thing we did was we looked at the experience of people experiencing homelessness, and a part of our community that could not meet the definitions of quarantine because of their living situations. And we've also partnered with the University of Maryland and the city in standing up the Lord Baltimore as a quarantine place for people who don't have the ability to be quarantined within their own home setting. And so we have also done that. We've also been really partnering with the city and the state around people experiencing homelessness, the Latinx population, which is being even higher, disproportionately impacted by a positivity rate and spread within that community. And we have now teams that are going in and doing community testing in the Latinx communities. And so we've also partnered around jails and prisons and detention centers. So clearly the Hopkins team has really reached out in a variety of ways as a system to support many parts of our communities. And we should all be very proud of that, Paul.
So, and the other thing that I think we're really proud of is the GO team. That we formed the GO teams to help in catastrophes like hurricanes, but the GO teams have been deployed to the local nursing homes, which account for a great number of the COVID-19 cases here in Maryland. And the clinicians help test the residents and assess the health of those with disease and provide support for the nursing homes and their staff. It's been a great collaboration. And again, just another example how Hopkins understood, I think, early on that we needed to do this not just as Hopkins, but as a community. And I think it's been very effective in helping those in the nursing homes. Kev, the pandemic's changed the way we pursue our missions. We talked a little bit about how we're changing our delivery system. One of the things we're doing is figuring out how to provide the social distancing in the common spaces we have, which is not always possible in patient care areas. So that's why having worn PPE was such an important part of it, and distancing ourselves and making sure we don't spread it within our hospitals. Could you talk about some of the other things that on the healthcare delivery side that we've done to sort of keep our patients and staff safe?
Yeah, Paul, at this point of where we are in the phasing of reopening, we, as you said, we have to think about social distancing, just not in our clinical care areas, but as we think about people returning to work, we have teams who are looking just at the guidelines for reopening up some of our facilities that we actually closed. And a part of that will be thinking through how we manage social distancing just in the workplace, but also even how we bring patients into outpatient facilities and how we do that safely, both from a provider and a patient and family perspective. We went to visitation limitations or in our visitor policy, primarily from a public health perspective, to stop the spread, the community spread of the virus internal to our organization. That has not been an easy thing for many, but as we know, that's been something that's occurred across the country in terms of restrictions on visitation policies. The question now, as we begin to open back up and beginning to live in a COVID and non-COVID environment, what will that look like? We have continued to restrict visitation at this time with the ability to ask for additional requests in terms of if someone is experiencing end-of-life issues or other types of issues with patients who maybe have ADA needs and additional support. We have ramped back up our elective procedures in our ambulatory surgery center, and my hat's off to all the teams who have worked so hard to bring us to that moment in time. We now have a phased plan of opening our ambulatory clinics, and that is taking place now. So we are starting to ramp back up the non-COVID parts of our business. I think one of the things that you and I have talked about is now as we look at our non-COVID patients that are presenting to us, they are presenting to us much sicker. And it's because they waited with some of their chronic illnesses to not come to the hospital. And now that they're presenting with a higher acuity of needs. And so I want to thank our teams for trying to balance the now COVID needs of our community, but also the non-COVID patients that are presenting on the back end of this first surge who are more acutely ill and require our levels of care. Paul, you may want to talk about the impact we've had on the provider side around telemedicine, because that's been another great success story.
When we look back on this pandemic, one of the things I think will be recognized is how it accelerated changes on healthcare delivery system. And I think there's no better example than telemedicine. We went from providing dozens of telemedicine visits a day across our system to 5,500 every day. The transition was amazing. The teams that enabled that just were fantastic. So hard to do it, and it has really changed the way we practice medicine. And although we may not do it at the level we're doing it now in the future, it will be done in a way that none of us would have predicted for the foreseeable future. I think it really has transformed medicine. The only other thing to state before we talk more is, one of the reasons that we were able to handle this so well and protect our patients and staff was the proactive way we made sure we had PPE for everyone. And it's really Lisa Ishii, Burton Frola, and the team who worked tirelessly to ensure that we had the equipment we needed. It was the teams who went to the warehouse and built face coverings. It was just such a team effort, and people who went home and sewed cloth face masks. It really was things I'm most proud of, putting together the P3 packs. Really, people just did a great job.
Paul, you and I've had discussions around how this has also impacted the way we educate our learners. And you may want to talk to folks about what we've had to think about there.
Yeah, I think as people think about how we could teach in this, we had our medical students who were on the clinical rotations. We pulled them off really because we were concerned about our PPE supply. And as we firm that up, we are now trying to get them back on the wards. In the meantime, we wanted to be able to still have them continue their clinical experiences, but at a distance. And we were able to do that with multiple online courses. Again, thanking the faculty for just understanding that we had something that had to be done urgently, and do a series of online electives for our third and fourth year students that are amazing and really good teaching opportunities. Our rising fourth year students are now back on the wards, now doing sub internships, and we hope by July they and others will be doing their clerkships. They won't be directly caring for COVID patients, but they'll be a key part of the team again. And we're thinking through what it will look like in the fall when we have our first and second year students who are still would be in classrooms. We'll probably have hybrid experiences with very small groups so that we can ensure their health, but a lot of online experiences that I think will change training forever. Our researchers have also really stepped up here. We have amazing people here doing amazing things for COVID research. And that is from groups who are participating in some of the large national clinical trials of therapeutics, to people who are thinking about vaccines, to groups who are trying to take precision medicine and apply it to these patients, asking the key questions about why some people get sick and why other people don't, and why some people die and some other people don't. We still don't know those fundamental things. We don't know if the antibodies are protective that people develop to this. And there are real fundamental questions we're trying to answer, and the teams have been fantastic. And a lot of that has come from the university, a lot from philanthropy. We have had multiple people give us large gifts to help support the research, to help us understand this disease better, which is really the key to overcoming this, is understanding the disease, developing therapeutics and vaccines to help us.
Paul, I think we've learned many lessons that will actually further influence our strategies going forward into the next phase of this pandemic. And as we ramp back up to start to lead key work groups, you and I on a daily basis are really working with our teams, looking at staff and provider availability, bed capacity needs now for COVID versus non-COVID patients, and how we'll manage that moving forward. A part of that really is around assuring we have appropriate ICU capacity. In addition, PPE availability is something that you and I look at on a daily basis and understand our current burn rate and future burn rate and the implications of that. Also, I need to thank the Department of Pathology and Ralph for all of the team's work there in standing up our testing platform. The testing capacity and also the supply chain needs there have been a part of what he's addressed. He and the team have addressed and done an excellent job. And so we should be particularly proud of the work they've accomplished. And then really thinking through how will we respond to a second surge. And and what will that look like, and how will we use our facilities across the health system. And then finally, you and I have been having ongoing conversations with senior members of our team to really think through what will Johns Hopkins medicine look like on the back end of this pandemic, and how will we be different? And so those are some of the teams that I know you and I have been focused on in trying to make sure that we are prepared for not just what we've done so far, but what we'll do in the future.
And we're also thinking about the non-clinical workforce that will be coming back to work, and how we make sure that we can establish safe environments for them to do their work as they come back. Because these restrictions will be lifted. We're going to have to ensure people have PPE. We're going to have to make sure that they can socially distance in their rooms, and what role telework is going to play in the future. I think those are really important questions that we're going to be addressing over the next several months.
And I think we're going to be thinking about how Zoom meetings might become a part of the social norm in the future as we think through this. Also, how we manage elevators and office buildings that we may be in, where we take our lunch breaks or our rest breaks. And let's just say lots of hand washing no matter where we go.
Lots of hand washing.
So clearly we'll need to think about all of those things as we start to bring folks back into the workplace.
You know, Kev, when we've talked, I think the one thing that we both want to emphasize today in this town hall is the thanks for the people who have been on the front lines, putting their lives at risk, taking care of these patients. Their courage, their bravery, their resilience, unwavering support for their patients. It is something that has made, I think, both of us so proud of being here at Johns Hopkins Medicine. We can't put into words how thankful we are for the people who have really sacrificed to take care of our patients.
You know, Paul, as I've rounded on the units of all of our hospitals where we care for COVID patients, I have been thankful to watch our teams come together from different places within our organizations. For instance, CRNAs that are really helping the teams take care of the patients who require ventilation. When I look at our peds nurses, intensive care nurses who stood up and trained and adapted to caring for adult patients, and at the peak of COVID, everybody came together in a meaningful way. And I really want to give a shout out to our colleagues in the Department of Medicine who have really burdened a significant part of the COVID response, but also their specialty colleagues who have stepped up to support them in staffing the provider models. And so Paul and I look forward to a time that we can all be back together in this new norm, whatever that may look like. And we'd like to leave you with a special video today dedicated to every member of the Johns Hopkins Medicine team. We want to thank you all for taking care of our patients, their loved ones, and each other. Thank you.
Thank you.
Albert Einstein said, "We still do not know 1,000th of 1% of what nature has revealed to us. This much I do know. As surely as day follows night and winter melts into spring, we keep going. Not because we are unafraid, because we rush in anyway. Not because we are invincible, because we persevere despite the odds. We will bend and stand firm. We will be loud and fall silent. Somewhere down deep in our nature, we will seek and find the strength, stamina, wisdom, and purpose to keep going. Tomorrow may be uncertain, but as long as the small blue planet turns, tomorrow will come, and with it, the promise of a new day of possibility and hope for our patients and for each other.